Hi, good morning. I'm Sarah Shannon, and I'm going to talk a little bit about the history of DGH and the People's Health Movement. And I wish I could be there in person, and I'm glad to be part of this virtual meeting. To start with, the People's Health Movement formed coming out of an amazing event that was held in December of 2000 in Bangladesh. And what happened is, and those of you who may have heard of the history of Health for All, there had been a commitment back in the 70s, the late 70s, 1978, that the world made actually towards primary health care and to using primary health care as a way of achieving health for all, and made a commitment to achieve health for all by the year 2000. So in the late 90s, and 2000 was rolling along, and it was clear, of course, that health for all had not been achieved. And in fact, we were sort of on the wrong trajectory to achieve health for all. And a network of grassroots health activists, several networks, came together and began to organize something that they decided they would call the People's Health Assembly as opposed to the World Health Assembly, to call attention to the fact that health for all had not been achieved by the year 2000 and what it was that we needed to do to make something happen. So that eventually became this rather amazing event where activists from over 70 countries came together in Dhaka, Bangladesh in December of 2000. And it turns out that Lanny Smith and I were among the handful of people from the United States who were actually at that meeting. There was actually 6 of us from the United States at this meeting that was with 1,500 other people. And it was mostly because of historic connections with the networks that were involved in organizing the events that those of us that were there from the United States were actually there. And I have to say that, it was truly an amazing event. To be able to connect with all these activists that had been doing health solidarity and health justice and liberation struggles in the 80s and 90s from all over the world, who'd been working in all these different facets and aspects of promoting and really struggling for health for all. It was really inspiring, and there was an amazing amount of energy. Because there was actually so few of us from the United States, Lanny and I ended up translating for the Latin American delegation. There was no real formal translation set up for all these people from all over the world. It was kind of crazy, but in fact, the building that we were meeting in was being built around us during the meeting. It was a fun time. And the result of that gathering was actually the collective writing of the People's Health Charter, which it remains the foundational document of the People's Health Movement. It was a truly powerful and transformative event. And I know that Lanny and I both returned to the United States really amazed at having been part of that. But it was a very conscious decision on the part of the organizers not to involve a lot of people from the United States. It was intended to be a South-South kind of a networking thing. And those of us who were there, we were more there as friends than because we were people from the United States. But several years later, in 2003, DGH and Hesperian, the organization where I work, and I'm the director of, we were approached by the folks that had taken on the job of trying to lead this movement that grew out of this amazing event. And they said, we were really intentional on not including people from the US and from North America in this event and in our work, but we realized that that was really wrong, because not only is there a struggle for health needed in the United States, but also our struggles all over the world for people's health require us to confront US policies. And we really need a people's health movement in the United States as well. So they asked DGH and Hesperian to take on the modest task of organizing such a thing. We said that it would be really difficult for us to even do the United States, but that we really couldn't speak for Canada, given that they had better policies, and we probably shouldn't be representing Canada, which everybody said was fair enough. So we modestly decided we would just try and organize people's health movement in the United States. Our first activity was to launch a 10-city tour in 2003 with the help of course, Lanny and myself and Steve Miller and Denise Zwallen and several other folks. It was crazy. We did a 10-city tour on a shoestring. I think we might have spent a few $100s. It was really, we were earning the money as we were going, kind of thing. With two folks from PHM India, Ravi Narayan and his wife Thelma, who were representing the Global Secretariat at the time, and Dr. Zifrullah Chowdhury, who was from Bangladesh, Gonakoshtakunda in Bangladesh, that had hosted the first People's Health Assembly. It was a crazy time, but a really great way to launch and make connections for People's Health Movement in the United States. In early 2004, Lanny and I were both able to attend a People's Health gathering that was held in conjunction with the World Social Forum in Mumbai, India. And we were introduced as representing People's Health Movement in the United States in this big gathering of, I think it was about 800 people. And everyone applauded us. We stood up to be recognized. And then I sat back down on the floor with a group of women from Bangladesh with whom I was sitting. And they all turned to me and they said, if there's anything we can do, anything at all we can do to help you, you must let us know, because your job is the hardest job, because you were trying to organize People's Health Movement in the United States. So we want to give you our solidarity. And it was just this beautiful moment where I realized that despite working in Central America for 15, 20 years at that point, I'd never really experienced the fact that I really needed solidarity, that we really need solidarity in the United States from folks from the rest of the world that are doing that struggle for health with us. And it was just a beautiful moment. And I think that is actually a wonderful way of describing the kind of network that People's Health Movement is, because it is definitely collective solidarity, multi-directional solidarity, and it's really an amazing thing to be part of. A few other highlights that are related to DGH's history and participation in People's Health Movement I'll just share. Juan Carlos and Irma were both featured at the People's Health Assembly, the second People's Health Assembly in Cuenca, Ecuador in 2005, and made quite an impression and quite a hit there. And then a number of folks from DGH attended the third People's Health Assembly in Cape Town, South Africa in 2012. And then following that, Linda Sharp and Alex Luger and a number of other folks, but Linda and Alex really took the lead on organizing a week-long International People's Health University, which was a deep dive into the political economy of health and environmental justice and environmental health. And it brought together activists from all over the United States, from disparate backgrounds. And it was really an amazing event to be part of. And that was another big highlight of People's Health Movement US in 2013. And just one more example of sort of the long history that DGH and People's Health Movement have had.
It was you know, there was nothing like that first time together. You were there for kind of the rematch, which
anniversary,
which was quite awesome. And although for political reasons, we weren't even able to have it at the same place, GK Savar. But when we went there, you've heard the story. I mean, the place was built kind of under our feet. It was like a magic castle, built in solidarity, and um, and so that was the original, the People's Health Movement. It wasn't even People's Health Movement. It was a People's Health Assembly. The People's Health Movement came afterwards. It was People's Health Charter. They came out of the People's Health Assembly. And of course, Doctors for Global Health is one of the participants there, was the original signer of the charter, myself as an individual, but also Doctors for Global Health. Um, and um, and there was a lot of excitement, as well as the pain. It was the year 2000. There wasn't health for all. That didn't surprise many of us, but that was the reason that the People's Health Assembly was started, and then the People's Health Movement came into being. Well, what to do with the United States at that point, right? You got 2000. What are we going to do? There's so much energy, so much capacity for in terms of resources, but also so much to be wary of in the United States. And so, uh, what the People's Health Movement leadership decided was to there should be from USA and Canada, there should be representation, and within the USA, there should be some movement building, or at least some attempt to do that. And so they asked the Hesperian Foundation and Doctors for Global Health to try together to promote people's health movement within the United States. So in terms of the representations, that was Sarah Shannon and myself, and my role on the steering the global steering group was also as an ambassador of some in some ways.
Hello, my name is Lee Haynes from People's Health Movement USA, and I'm joining you today to speak a bit about our movement and the work that we have planned. So I'll talk a little bit today about our overall strategy, actions we have planned, overarching goals, and finally give you some info on how you can join us. So PHM US kind of works on three streams of organizing and strategy. We work locally with local communities to mobilize around issues that impact them directly. We also take national action, for example, petitions or statements on US policy that impacts people's health, and also work for the same with partners across the country. And finally, as already mentioned, we work in solidarity with global partners to tackle and push back against US policies that contribute to ill health in other parts of the world. And so now to talk about some of our actions and how we work. So I talk about health, but I and PHM take a very broad idea of what health is, and we take action on social determinants of health. And so when we think of health, we think about the right to health, but also, the right to water, the right to education, the right against being discriminated against, the right to have a family. So we apply this rights-based approach across all of our actions. We also apply an anti-racist and anti-capitalist lens to our work, which also draws in our political economy analysis of health. And finally, we take group and individual initiatives. So if a person has an initiative or work that aligns with the work of PHM US, that person is totally welcome, and we welcome you to link up with PHM as our network and maybe resources. There might be some synergy in your work and the work that PHM does in the US and around the globe. And we also take group actions. So we have several working groups that have kind of recently I shouldn't say come together, but been refined. So over the past couple of Saturdays, July 18th and July 25th, members of PHM, friends of PHM, came together for 2 days of strategizing, organizing, planning our work for the next several months and year. As you can see here, several working groups came together, and I'll note that there was interest in a working group on reproductive justice and safe and healthy work. The interest there remains. So if that's a topic that's interesting to you, then please reach out about that. I can put you in touch with the right people. So I want to go through each of these working groups and just give a little highlight of the plans that they developed to work on moving forward. There was a working group on health systems reform and access to respectful care. Their issues identified was to work around strengthened public health systems and UHC, which consist of action around a single payer health system in the US and also work against privatization, in particular of health services. And some of the actions that they intend on pushing forward in the next few months include particularly advocacy around the election and other legislation, and also raising awareness and doing some education around privatization of health services. There was also a working group on environmental justice. The main issues of this group are climate change and extractivism, focusing on extractive industries and the harm they cause across the globe. Their work will kind of focus around cross-border solidarity and action, internationalism, in the sense of focusing on, for example, companies in the US and Canada in particular, whose, for example, mining activities damage the environment and people's health in other countries such as South Africa or El Salvador, and kind of build solidarity and work with folks in those countries in order to push back against these practices and companies. And also awareness raising, accountability among the companies, and also pushing in, for example, US and Canada, divestment from extractive industries. There's also a working group on trade and health. The trade and health bold statement is that they want to stop unfettered capitalism. And this is with the sense that, there are some things that just should not be under the lens or under the realm of capitalism. And they think that kind of working across countries, particularly when there's a bilateral or multilateral agreement, kind of bringing those countries together in order to strategize and plan on how they can push back against their governments from joining these agreements, and also highlighting some of the impacts that these agreements may have on the ground in different countries. And some of the activities they have planned are public education, media hits, op-eds, and book clubs for discussion and learning more about the impact of trade on people's health. The working group on immigration and migrant rights identified a very current issue, which is repatriation of people infected with COVID-19. And part of their work, they want to monitor this activity, denounce and challenge U.S. action, and particularly some of their activities will be strengthening connections regionally in Central America or in Mexico and other countries in order to develop advocacy, strengthen advocacy, and push for policy change around this issue in particular. And there was a working group on challenging U.S. imperialism in global health. Main issues for this group include looking at the global public goods and looking at global health governance, for example, with the World Health Organization. And they intend on focusing on multilateralism and using this moment of the COVID-19 pandemic to show how the system we have does not work and kind of use that as lessons for how we can do things differently. They also identified policing and racism as a global issue, making connections between state violence and racism, or for example, police activity against Black Americans as compared to police activity against Palestinians. And some of their actions include education, awareness raising, and building partnerships across countries. Finally, a working group on anti-racist organizing developed spontaneously, actually. And this group, interestingly and importantly, wants to work to examine PHM's internal structures and processes and whether there are racist structures and processes or colonial structures and processes that PHM needs to think about how to break down within the movement itself. And their work hopefully intends to entail building relationships across movements in order to create a space for conversation and learning about what sorts of practices are going on within PHM that may need changing. And one of the outcomes that maybe of this anti-racist working group is a collaborative toolkit to go online to share the learning. And so now just to say some of the kind of overall goals that I think came out from what the working groups have put forth. And first is to build momentum for the right to health in the US. And also to really strongly call out the actions of the US that cause ill health globally. And last, to build a global community for health for all and, a community of people who struggle for the right to health and also for a world in which equity and justice aren't so hard to come by. And finally, I want to let you know how to join us. On August 15th, PHM USA will be holding a national assembly, and this is an opportunity for us to come together to present these working group plans, to strategize further, and also welcome new folks to the movement who want to see how to get involved, see what work is being done, and where they may be able to plug in. There is a link there to register, bit.ly/phmusa-assembly. And also, please take some time to visit our website to learn more. It's phm-na.org/USA. And finally, feel free to email us on connect@phmna.org. So thank you for your time. It's wonderful being here, and I hope you have a great rest of your assembly. Thank you so much.